I'm sometimes asked why a penile implant may be the best treatment option for you. Well, if you've tried oral medications or other erectile dysfunction treatments and you found them to be ineffective or intolerable or contraindicated, you're probably looking for a more long-term solution like the Coloplast Titan Penile Implant. Understand how important intimacy and spontaneity are. This can be a great solution for you and your partner. The penile implant essentially allows you to be in control of your erections without any external equipment, and this device produces a very reliable and effective erection. With a penile implant, you no longer have to have any worry about your erections, and you can focus on providing satisfaction for yourself and to your partner. Now, the penile implant is placed inside the body through a very small opening or incision in the skin. This is typically completed during an outpatient procedure in the operating room, and during the procedure, the cylinders will be placed in the shaft of the penis, the pump in the scrotum, and then a reservoir containing the fluid placed in the lower abdomen. All components are completely placed inside along your existing anatomy. Well, most men return home on the same day after their surgical implant is an outpatient surgery, and they resume light activity usually within the first few days, but on average it takes about 4 to 6 weeks with most penile implantation. The issue is that those of us who are high-volume implanters usually have our patients cycling the pump by inflating, deflating, and maybe even having sexual intercourse within 2 weeks. So before you begin to operate the device, you'll have a checkup with me, and I'll provide you with all the instructions for return to sexual activity and the proper use of your implant and to address any concerns that you have. But remember, with any surgical procedure, there are always risks and complications that can arise that could change the length of your recovery. But as stated, in the hands of a high-volume implanter, it should be about a 2-week recovery on average. After the recovery period, again, about 2 weeks in my hands, you should be able to return to all your normal activities. And once you're cleared to use the implant, most patients will be able to even engage in all sexual activity, not limited to just sexual intercourse. In fact, for most patients, the penile implant procedure and the device itself should not impact the ability at all to have an orgasm or to ejaculate. At this time, most patients will also be able to return to day-to-day activities. All types of physical activity are always possible, including swimming, biking, riding a horse, and any other types of sports you can think of, and any other type of activities that patients were used to do prior to the implant procedure. The Coloplast Titan implant is MRI conditional, which means it can be safely scanned through an MRI machine when the scan is done according to specific conditions. Now, after your implant, you will receive a patient implant card containing all these specifications that can be provided to the imaging center before an MRI is performed. Like all other implants, such as those for knees or hips, the Titan implant may appear when going through airport security. So after your implant procedure, you will receive a patient implant card that can be presented through security upon going through the airport. Now, some men alert security personnel of their implant and show them their implant card before they even step into the X-ray machine. Another question that is oftentimes asked is whether or not insurance will cover the insertion of a surgical penile implant. Luckily, most insurance companies, including Medicare, do cover the penile implant. It's important to be aware that there are multiple factors to consider when it comes to insurance. Coverage and costs may vary based upon your policy and location, and my office will do their due diligence to work with you and help determine, your individual coverage and any associated out-of-pocket costs.